Oh, hi, it's nice to meet you.
Nice to
Sorry.
meet you also.
My name is Samira. So could you please introduce yourself and tell us a little bit about yourself to begin with?
Sure. I'm Keâna Nicole Montoro. I'm 50 years old, and I was diagnosed with IgA nephropathy, a form of kidney disease, in 2020, July 2023. I was hospitalized from a headache that I was getting for about a month, and I finally decided that, okay, this is not normal. I think I need to go see. And when I went in on July 29th to my doctor's office to ask what's going on, she did triage on me and did three blood pressures. And that's when she realized that my blood pressure was really, really high. So she had told me that I was not allowed to leave the office, that I had to either go to the hospital by someone picking me up or via ambulance. So we went to the hospital. I was emerged. I had a doctor's note saying that I had high blood pressure. But anyways, 4 hours later, I was still in the waiting room, and I just told my husband that this is getting too much now. And when the nurse checked, my blood pressure was at like 265 over like 180, and then by the time the highest it was 272 over 190. So it was just I was borderline stroke. So that's when they took care of me, did what they had to do. They put me into the ICU, and then I was there for 3 weeks. And then after 3 weeks, they did a lot of tests, and that's when I was told that I had my kidneys had failed. At that time, it was only at 20%, and I was in shock because I don't know how or when this would have manifested or happened. As I was taking, yearly visits, even though it was during COVID, I was getting iron infusions. All my blood work was being updated, so I don't know how this has happened naturally. And then a few months later, I did a kidney biopsy, just to confirm that, if there was no cancerous cells. And that's when they determined that I had IgA nephropathy.
Hmm.
And then now fast forward, I started dialysis September 2024. And I have
Hmm.
4 children, and 2 grandsons. And yeah, so here I am trying to go through this journey as normal as possible.
Thank you so much for sharing that. How do you think that kidney disease, when you first got your diagnosis, how did you feel physically, emotionally, and mentally? How did it affect you?
So mentally first, I've always been a positive person. So I just remember hearing the doctors tell me when I was at the hospital, and I just took a deep breath and I said, okay, what can I do now? Like, what's the next step? I've always been on survival mode. I think from a younger version of me, I didn't have a good childhood, but or adulthood, so I was always on survival mode. So my instincts just kicked in to say, okay, what can we do? I don't want to focus on the negative stuff. What can we do to get this going? But as anything, as human beings, even though our mind is strong, the physical parts of it starts to remind you that you're not okay. So the physical aspect of it was very challenging for me because I'm an upbeat go getter, like ready to go conquer the world kind of thing. And then my body was telling me, no, you're tired. No, your bones hurt. No, you can't breathe today. No, I just want to sleep. So that was a struggle for me, because my mind and my physical aspect of it was fighting each other.
Thank you so much. What do you think that people don't understand about diagnosis? How it's portrayed maybe on social media or how you expected it to be versus how you felt?
Well, anytime there's a diagnosis, um, we always, for some reason, we as human beings, we picture someone that looks really sick, right? Really frail, really fragile. We don't know what a diagnosis looks like. We all have a story to tell. We all go through things. Some people display it more than others. I believe we do wear masks when we are going through hardship. So that's one thing to really identify the difference of hearing a diagnosis, because we try to not show that on our outer. side.
Yeah, I agree, and I thank you for sharing that. So you mentioned while we talked that you felt like life moved on without you. Could you share more about how that shift in identity made you feel?
Yes, while I go through my 3 times a week, 4 hours at a time sessions, I felt like the world still moved on. So when I'm watching my colleagues go to these amazing trade shows abroad, and I used to be part of that, and I'm no longer part of that. And so my world, my inner world stopped because I stopped doing those things while everybody else moved on. I see everybody else, you know, celebrating, going to these celebrations, and I'm not invited, or I'm not thought of because, oh, she's not feeling well, so maybe it's not a good idea. So feeling left out was definitely a challenge for me. Um, but that's just my perspective. When I ask my friends, they said, no, 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 we've always wanted you to come out. We just don't know how to approach you. So, I've learned that obviously communication is key because we can't assume what the other party is feeling. Um, but we have to always ask questions to make sure that they're not left out.
Your experience is totally valid, and I just wanted to know, I feel as if that must have felt very overwhelming. Was there a person or an activity or something that helped you get through this time?
That I felt left out?
Yes.
Yes, my work. Obviously, my previous employer had terminated my employment. So I used to go to Italy and France and Spain for my work, and now I'm no longer part of that. So I felt that part of who I was, that part of my identity, um, is gone. I still feel that my industry has forgotten about me and my capabilities. I think they just remember me from then and not now. And it's not their fault. You know what I mean? Like it's an industry just like anything else. Like people do have to move forward, business as usual. But it's sad because you do get forgotten if you don't push yourself into those atmospheres or to those areas.
Was there a person who you felt like helped you a lot through this time?
There's few. I mean, other than my immediate family, I have a few girlfriends. Yes, one person, Tamara,
It's okay, feel free to
she's
take your
been with
time.
me every step of the way from the beginning till now. He continues to support me. Like as recent as I want to do the kidney walk from the Community Foundation, and so she's the first person to say, "Oh, I'm gonna make T-shirts," and just stuff like that. So yeah, I have a good amount of handful of people that support me right now.
That sounds really heartwarming. I'm glad that you have a
Mhm.
friend who can support you like that. Um, if you don't mind me asking, how has kidney disease affected your family dynamic, especially your teenager and adult children?
Well, my teenagers stopped going to school. They felt that if they left me, that I would die. If they left the house, I would die. And that's something that they shared during therapy. I'm that one person that, I set all the plans, I set all the outings, I do all their their athletic stuff, so I plan all that stuff, and now they don't see me as excited to do this because I was really exhausted in the beginning. Um, and I was sleeping a lot. I
Mhm.
didn't go out a lot. I was in my room at least 5 times out of 7 days in the earlier stages. Um, I was very weak. I didn't really eat too much. So it took a toll. And of course, as their mom, I like to see that. I mean, they have different personalities. So the younger one, he just turned 14. He's an amazing caregiver. Like he was there when I was vomiting, when I wasn't feeling well, change my clothes, wash my hair. So he took on that role at a very young age, like I guess 12, 13. And he didn't want to leave my sight. So grade 7 and grade 8 for him was a struggle. And then with my older son, grade 9 and grade 10 has been a struggle. So things are better now. Like we have a new momentum now. They're seeing me feeling better. So hopefully this school season will be better for them. As for my older children, I have an older one, 22 years old, that lives with me still, and she goes to school, and
she's trying to be positive, but she did break down a few weeks ago, just before exam, saying, I have so much on my plate. I'm trying to work part time. I'm trying to be a full time student, and my mom's dying. So all these things are obviously affected them in different ways. My older daughter, who lives out of the house, and she has her own family, the same thing. Like, she tries her best to come and see me, but I know that she avoids me because she doesn't know what to say to me, or she handles this differently than the rest of the children. So it's been a huge, huge change in our family.
It takes a lot of strength to talk
Yeah.
about that, to go through that. I'm so sorry that happened to you, and thank you so much for sharing. Um, what do you think, like, what surprised you like the most about yourself or about a family member as you went through the beginning stages of this disease?
What surprised me, I think, just my resilience still.
Hmm.
Um, I'm able to kind of determine my reality and my goals
Hmm.
versus what could be in a negative way and what might happen.
Well, I might not have enough time to do this. I might not be able to travel. I may not be able to find work. I kind of changed that thinking to I get to spend more time with my loved ones. I get to be grounded and not be rushing to do things anymore. Like I'm in more in the moment. Enjoying more of time as opposed to rushing through getting out the door and meeting those time slots. I'm actually now just stopping and embracing the time that I have, if that makes sense.
So, was there a moment during this journey where you really felt like it hit you and you were like, wow, this is my reality now?
Every day, every day it hits me. Every day when I say, okay, today I'm going to be able to do this, and then I start it, and then that within like 15 minutes, my body reminds me that I have limitations. If I say I want to go for a drive and go away for the weekend, I have to remember, oh no, hold on a second, I have to make sure I'm not going to miss any treatments or how long I'm going to be away from the city. Like stuff. So every day it reminds me.
Thank you for sharing that. And yeah, it must be really hard. I'm sure your story is going to bring lots of awareness and help lots of others who are feeling the same way. Um, so what type of dialysis are you currently receiving, and what does a typical treatment day look like for you?
Okay, so I do chemo. So I do the in-center hemodialysis, and so I wake up, I pick up my bag, and in my bag I prepare my pillow because I want to be comfortable, and a heating pad because they get cold. So I bring that with me. I bring some snacks. And then I go to the in-center. I arrive there around 7:10. I'm the second chair, so I usually get hooked up between 7:20 7:25 a.m. And I'm there for 4 hours. And sometimes I will take a nap if I'm really too tired, but it's hard to take a nap because there's a lot of noises, a lot of patients need machines beeping. So I bring a mask and I try to close my eyes, or I put on music to help me sleep. Or otherwise, that's my time when I start going through social media for positive affirmations to help me get into this positive spirit and start educating myself of what I'm going through. So I'll use that time also, because then if I have questions, then I can ask the nurse that's there to for the medical expertise, and I can kind of go back and forth on what I've read versus, and then ask them to confirm it. So that's what I usually do. And then around 11:15, they start to unhook everybody on the second chair. So again, they get to me around 11:20. Um, they unhook me. They do my blood pressure every 15 minutes. Actually, sometimes it'll be every 30 minutes if I ask them to do it in those intervals. If I want to sleep a little bit, I'll ask them to do 30 minutes because it does wake me up. And then it's always a wait. They check your weight before dialysis. They check it and after, just to make sure you're dry weight and they've taken enough fluids, or And then your blood pressure, like I said, it gets taken all the time. And then I go home. Sometimes, like yesterday, I was not feeling well. I was feeling very jittery. And I had asked the nurse, why do I feel this way? She feels that they've taken too much fluid from me and they had to look up my numbers. So all day yesterday, I felt like I had pins and needles all over my body. So I just wanted to sleep. So I came home at 12 and I went to bed at 2 o'clock, woke up at 4 to go to the bathroom, went to bed again, woke up at 9, went to bed again, woke up at 2 in the morning to go to the bathroom. And then I slept the rest of the remaining of the morning. But it's just it was an off day. So I can have really good days where I'll have energy. And when I do, I'll be able to make some lunch for my
Mm-hmm.
kids. But if I don't, I will just go straight. Like I just want to be in bed.
Okay. So you mentioned that um dialysis is even like so not only do you have to differentiate between what type you're doing, but even in the type that you're doing, it's a journey and like not one size fits all.
Correct.
Okay.
Correct. I was told that you have options to do like peritoneal and as well as the fistula, but like I don't know. Just for me, I felt more comfortable with this, even though they say this is the most um not dangerous, but to get more infections because it's open. But I've been so diligent with it that I feel more comfortable because I don't feel anything. Whereas when they do the fistula, like you're injected twice, right? Two needles at a time, and they say over time it gets better, but I just don't want to feel the poking every time. So for me, this is the choice that I've worked for now until I decide later. I'm okay for it for now.
Okay. And you mentioned that social media helps you a lot. Could you tell us like what you see and if there's like any like specific content that you search for and anything about social media?
Well, I read up a lot on the kidney foundation a lot, and then there's a few like female social medias out there like that does a lot about women empowerment because I'm all about that. I have daughters, so it's always about women empowerment and rooting for each other. And then I follow another one with chronic illness,
Mm-hmm.
and then I'm on a Facebook group. Um, a few Facebook groups. One's called Dialysis is not a death sentence, and I have another one. So they're all related to dialysis. So if I have questions, I go in there, or if I don't have questions and I just want to know if others are feeling the same as I do that day, then I just read posts and 99.9% I do find posts out there that makes me feel the exact same way as that person does, so I don't feel alone.
That's amazing that you have a support group online that can help you go through what you're going through. Can you tell us what it's been like being on the transplant list, the waiting, the emotions, and the unknowns?
Yeah, well, right now I'm not on a transplant list. I was when I
Uh-huh.
had living donors, but my husband and my daughter was ruled out as not matched. So now I'm not back on the transplant list because he said there's a long waiting list, and
Mhm.
so I'm trying very hard to get living donors so I can be put on back the transplant list. It is a long journey. I mean, just between for my daughter, it was like a 6 months wait until her results were in, and they only do it one at a time. So even if I have like say 5 people waiting for me, I got to do one at a time, and that can be 6 months at a time. So it's very frustrating to know that they can only do one at a time. So that's telling me that the healthcare system is backlogged and not enough people, or just not enough support for this particular disease to help people get through the transplant list. So it's shocking of how much and how many Canadians in Canada, Canada-wide, that is waiting for a transplant and going through the same things as I'm going through, and it's all different ages, right? So it's not one is better than the other, and it's just a matter of matching.
Yeah, that sounds really frustrating. I agree. Ever feel like giving up or like emotionally burnt out?
Yes, I do, especially in the beginning. I didn't even want to do the dialysis. Um, I didn't want to do it. I didn't want to go through it. I didn't. My best friend had passed away 2 years ago. My mom is in heaven, so I was like, I'm ready to go and see them. Like I had no care in the world to even go through this process. My daughter, my eldest daughter, was pregnant with her second, so she had asked me to stick around and wait for the birth of her son, which was in November. So I started September. So I told them at the time I would do 6 months. And now obviously we're past 6 months. So I'm feeling a little bit better mentally. And so now I'm willing to go as long as I can.
Wow, your strength is really inspiring.
Thank
So
you
you
so
would
much.
say that your children are like your anchor and like they're the reason you're continuing?
No, no. In the beginning, when people are saying, well, do it for your kids, I'm like, no, I'm not going to do it for my kids and I'm not going to do it for anybody else. I'm doing it for me. So I'm my own anchor, I'm my own reasoning because I sacrificed 26 years of my life to my children and I've given them the tools to survive without me. So it was not about them. It was more about what I wanted. Do I really want to be here? And the answer was yes. I do want to make more memories. I do want to see the world a little bit more, however they may look like. It may be a little bit slower in the beginning, but I want to travel again. And I just want to enjoy that aspect of my life now. Like I'm not in that frame of mind of conquering the world. I really did that in my younger years. That's why I worked really hard to get to that, and now I realize that I just want to enjoy and making memories.
That's really great to hear. How do you personally cope with the uncertainty and the long timelines that are related to your disease?
I cope by listening to music, happy music that makes me want to dance, that makes me inspiring words. So, like I said, I read a lot of motivational speakers, quotes, and so I started to share my journey this April actually. So that's why I started the Keeping for Keâna page. And so how I'm taking my journey to make it a little bit better for me is I want to spread awareness now about it so people can be a little bit more mindful and just spread awareness to it. And while sending out positive affirmations also.
Is there a specific motivational speaker you look up to or any idol maybe who has the same disease and you look up to them?
No, there's many different. I find that a lot of the social media people that I follow is a lot about. They're not really celebrities or a mainstream. It's basically other people like us that just spread the same kind of positiveness to everybody else. So I read many different kinds. I don't follow everybody. I just follow ones that resonate with me when I'm scrolling.
Okay, thank you. Was there a nurse, doctor, or care provider that had a significant impact on you? And what stood out about them?
So one of each, yes. So my nephrologist, who I met when I was hospitalized back in 2023, Dr. Hamidi, she became my regular doctor after the hospitalization. And even though I've addressed with her exactly what I said to you, that I did not want to do treatments, I gave her my reasons and she listened with patience and calmness and she validated my emotions. And then at the same time, she says, even though I hear you, but as your physician, the answer is no. And I'm going to do this with you. So it was one of those things that I felt more of a friend than I was a patient and doctor. So she became humane with me, and it was nice for her to humble me in that way. So that was like she listened to me, and then my nurses. I have a few nurses that I have right now. They remind me of my spirit. So they tell me, Keâna, you're so. Every time you come in here, you say good morning to us. You say thank you to us. You make me want to come into work when I know that I'm going to see you. So it's kind of nice. So I bring joy to them just like as much as they bring joy to me. And I'm like, what do you mean I have to thank you guys? You guys are taking care of me for 4 hours every other day. Look what you do. You have 3 patients each. Of course, like, it's the care that they're giving to us makes me feel special as if we're part of their family too, right? So there's a few nurses. Phaneusha is one of my favorite ones. Luz, Grace, Danica, Lino, like the Humber River Church site. Like they're amazing team over there.
That's really, really nice to hear. How did the moment when your doctor validated your feelings make you feel? And how did it shape you?
She made me feel heard. She, because like anything else, everyone is going to make you, everyone is always going to tell you the positive side. Well, you can do this, you can do that. But the emotions that come with that are very different, right? Like I can be the most positive person in the world, but the reality is I still have to live like this. So that's where the disconnect is with patients, is that I'm hearing you, but you're not feeling what I'm feeling. And when someone else is talking that doesn't have the disease, is talking about it, it's very hard to relate to that person or believe them,
Mm-hmm.
right? So with my team, with Dr. V, even with my social worker, Chintzia, even though they don't have this disease themselves, but they're so invested that you can see the care and the time that they put in to get to know their patient and learn their love language, basically, right? Because we all have different love languages. So just like I pay attention to who I'm speaking to and how I can connect with them, they're doing that with me too. So I feel like I'm in the same mindset. My environment is the same mindset, that I know that they're not just like pretending or just doing their job. They're actually caring about their patients also. So she made me feel that way.
So I love that's lovely to hear that the sincerity and they have that and you feel connected with that.
Exactly.
So yeah, what do you do to take care of your mental health while managing the physical demands of kidney disease?
I allow myself to be emotional. I allow myself and give my space to cry, to yell, to scream, to be sad, to feel pity. I allow myself to do that once in a while. I don't hold back on it. We are emotional creatures, and I am a very huge empath, so I will say it how it is. I will communicate that to anybody who's around me that's willing to listen, but I allow my feelings to go through however that may look that day.
Thank you so much. Wow, that sounds really like freeing and it sounds like you have like you're getting better mentally and yeah, that's great. So when we talked, you shared a powerful message of hope where you said everybody should spread your magic. So
Mhm.
spread your magic. And so what does that mean to you and how do you live it?
Well, I believe that every person in this world has something magical about them, whether it's a smile, whether it's a thought, whether it's a look, whether it's a friendship, everybody in this world has something magical to give someone else. And it's just a matter of reminding them of what they're capable of. So I've always wanted, I don't want anyone to feel left behind, right? I want people to know that they're seen and they're loved. And I just want to remind people whoever I'm talking to, if they're having a bad day, or if it was a birthday today, I'm going to say, it's your birthday today. Like, we're going to celebrate that. And I may be a stranger, but you know what? It's your birthday today. We need to celebrate that. So I just want people to feel, even for a moment, just to feel joy. And then I'm good.
I love your message of positivity.
Thank you.
So looking back, what are you most proud of in this journey?
I'm most proud of how I am now, seeing and visualizing a better future for me, even though of my limitations. Whereas before I didn't see that, or I didn't want to see that. I just wanted to be with my mom and my best friend in heaven. So I'm proud of me seeing a brighter future, even though I'm still waiting for a what if. So that's what I'm proud of. I'm
That's
proud
nice.
of actually having this conversation with you. I, I never thought that I would share more because I was very private. I didn't really tell anybody about it and then I went really public about it in April of this year. So thank you.
Yes. Oh, it's a pleasure to help you, and I know that like your journey will definitely inspire lots of others, and I feel really happy for you that you'd be able to spread your magic this way.
Thank you so much.
What's something that people often overlook or misunderstand about a life with kidney disease?
We talked about this earlier. It's appearance, right? When people think of kidney disease, they think that they're frail and they look unhappy and they're with the machine all the time. Like, if you didn't know me, without looking at not knowing my chest catheter here, like you've never known, right? So it's just that's what they overlook. They overlook how people look. They overlook of what is it supposed to look like. What does a kidney disease person look like? You know, it looks like me and you, right? So we have to just be kind a little bit more to people because we don't know their story.
Mhm. If you could give advice to someone just starting dialysis or someone who is newly diagnosed, what would you say to them?
Yeah, be angry. Yes, be sad. Yes, be angry and sad. Get it out of your system because then the next day it's going to be a different mood. But don't hold it in. Get it out of your system. Yes, this sucks. Yes, it sucks, but it will get better.
How has your perspective changed about how you handle the disease from the beginning to where you are now?
It's changed in a way that I'm not so angry as I used to be, or I'm not so pitiful
Hmm.
or sad all the time. Right now, I get to have my happy moments in between. I still get sad, I still get angry, and I still get pitiful, but now there's room for happiness. So that's the difference from beginning till now.
Could you tell us how a typical day might have looked for you emotionally when you first began versus now?
I still go through those emotions. Like I said, it's a little bit better now just because I'm also healing a lot of my inner traumas, my own. So I did a long, I've worked on myself and what really mattered. So I dug really, really deep, and I believe that's what's helping me get through this a little bit better because I was able to face all this stuff that I didn't face when I was younger, or all the anger I didn't face when I was younger, not even related to this disease, just stuff, of of decades of hurt, whether it's my parents or my family or an ex or friends or work, right? Previous employers. It's just I dug deep into myself and started healing through that. And I think that's what's making me have a better outlook now.
Okay, thank you so much. If you could go back to the beginning, what would you tell yourself?
That's an interesting one because I've always been a fighter and I've always been a survivor. So I'll just keep saying, keep being you. Keep being you. There's nothing wrong with you.
That's amazing. What would you recommend that a patient who's newly diagnosed, what would you recommend like they have, like a person that can support them, a hobby, or like a therapist? Like, what do you think is most essential in this journey?
All of them. I think in the beginning you should have a therapist to help you go through the emotions. Um, and then I think you should have a support person to guide you through it, and then have a hobby that will make you have your inner joy. Yeah, all three of them, all of them.
Is there a particular hobby that you partake in that helps you?
I have many hobbies. I'm such a scatterbrain that I have so many different ideas, and then I don't know which ones to start. But I do. I like to sing, so I'll sing to myself. Like I said, I love music, so I'll sing to myself, or else, yeah, by myself. um, and I like to journal. I like to write down a lot of my feelings and a lot of my gratitudes and aspirations and all that stuff. I like doing those things, and I like doing the coloring.
Hmm.
Yeah, I like doing those things.
Thank you. So is there anything else you'd like to share or any questions that I could ask you?
I think I just turned 50 that week also. So I just had this new happiness because I made it to 50 years old, and I'm like, I didn't think I'd be going through this at my 50. I thought I'd be in another island somewhere celebrating my 50th, but here I am. But nevertheless, I was still happy. No, thank you so much. And I hope that's what I want to do. I just want to be able to spread awareness and send and share my journey. And if someone else is feeling like crap the way I did, I can actually say, I understand, right? And I can actually connect with them and let them know, yes, today sucks. You're right. It sucks so badly, but I'm telling you, in a few days from now, because you're going to be doing this or XYZ, you're not going to feel this way. It's temporary, right? Everything's temporary anyway. So we have to make the best of it while we're here.
Do you have any last messages before we?
No, that's it.
Okay.
And then with you too, you continue to inspire and spread your magic to everybody.
Thank you so much.
You're
And thank you for
welcome
your
so
time.
much.
Really nice meeting you.